The drug of choice for an acute attack of migraine is sumatriptan. Syringomyelia is a lesion of the spinal cord placed distal to the brainstem and hence does not lead to an exaggerated jaw reflex, unlike in supranuclear lesion above the midpoints. Amyotrophic lateral sclerosis involves degeneration of both upper motor neuron and lower motor neuron. Sensations transferred by posterior dorsal column are fine touch, fine pressure, vibration, and joint position sense. Anterolateral column spinothalamic tract transmit crude touch, crude pressure, pain, and temperature. Bever's sign results from a lesion in the thoracic cord T9, T2, T10. Absent deep tendon reflexes despite corticospinal tract involvement with an extensor plantar reflex is characteristic of Friedreich's ataxia. Memory impairment occurs in embolism of posterior cerebral artery because of damage to hippocampal gyrus. The term post-traumatic epilepsy should be used if seizures occur after first week post-injury and are recurrent. Ethosuximide is primary agent for the treatment of absent seizure. Bulbar palsy involves element paralysis from a lesion of the bulb, medulla, or its nerves. 9, 10, 11, 12. Babinski's sign is positive in pyramidal tract lesion, while it is negative in extrapyramidal tract lesion. Taves dorsalis is characterized by areflexia resulting from degeneration, demyelination of posterior nerve root ganglia. Conus medullaris is associated with early and marked involvement of bladder. Motor neuron disease is associated with degeneration of anterior horn cells in the spinal cord. Bunionide bodies are inclusion bodies seen in amyotrophic lateral sclerosis. Urinary incontinence is primarily a feature of frontal lobe lesion. Oral clonidine and or nifedipine are the most commonly used pharmacological agents to control hypertensive crisis in patients with autonomic dysreflexia. Optic nerve gliomas are the most common intracranial tumors in neurofibromatosis type 1. Foster-Kennedy syndrome is associated with ipsilateral optic atrophy and ipsilateral anosmia with contralateral papilledema due to raised ICP caused by space-occupying lesion. It is associated with olfactory groove meningioma. Juvenile pyelocystic astrocytoma are benign, non-infiltrating cerebral astrocytomas with excellent prognosis. The commonest tumor in neurofibromatosis type 1 is optic glioma. Spinomuscular atrophy is a form of motor neuron disease that affects the lower motor neuron, anterior horn cell. The putamen basal ganglia is the most common site of hypertensive hemorrhage. Eunomic aphasia is the single most common language disturbance seen in head trauma, metabolic encephalopathy, and Alzheimer's disease. Duloxetine is first-line therapy in painful diabetic retinopathy.